Today is the International Day Against Drug Abuse and Illicit Trafficking. Painkillers, sleeping tablets, tranquilizers, doctors prescribe them and pharmacists dispense them every day. But those suffering from pain, insomnia or anxiety are at risk from the hidden pandemic of addiction to prescription and over-the-counter drugs.
Now, how can we notice that we are actually addicted to these so-called harmless drugs? We're now joined by Dr. Shakir Saldika, member of the South African Society of Psychiatrists, for more. Doc, thank you so much for your time and good morning. I mean, is it the case? Can you actually be aware that you may be addicted to prescription drugs? I mean, oftentimes when we go to the doctor, you think, okay, if this is good for me, according to the doctor, then surely I have to take this. It's okay. But can you equally be addicted at the same time?
Yes, hi, good morning. That is indeed the case. I think we talk about these drugs like painkillers and sleeping pills and anxiety treatments because they're effective when they're needed. So for a person to take these drugs at times is appropriate. The problem is we are in a situation where people are taking it more than what is required, more than what is necessary. And when you say addiction, I think it's not as simple as saying it's, the same kind of drug-seeking behavior that you would see with things like heroin and cocaine and so on. This is more subliminal. So people don't often realize that they're addicted. But the definition is more, or the better terminology would probably have been misuse or overuse. And that's usually what happens and leads later on to addiction where it's difficult to actually stop.
Doc, does that not then make it a little more dangerous? I mean, I know we're comparing hard drugs such as cocaine and heroin and such to, over-the-counter drugs, which you would, again, think that they are okay for you, especially because a doctor has prescribed them. But that not noticing and not realizing that you're getting to that point of addiction, does that then not make those kinds of drugs and that kind of overuse a little more dangerous?
Yes, absolutely. And in fact, that is the reason we decided as SASOC to shine a light on these so-called safe drugs, which are being used to an extent that's so huge in this country and all over the world that we can't actually measure it because it's, prescribed. So you don't know how much of it is prescription appropriate, how much of it is not appropriate. So to answer your question, definitely, I think it's a much more dangerous concept because it's perceived to be safe. And the thing with codeine is that when you swallow codeine, it actually becomes morphine. And the chemical name of heroin is diacetyl morphine. So they're very close compounds. So in fact, when you're taking something like codeine and large amounts of it, it's like taking small amounts of heroin every day.
Doc, what's the role of the doctor, the doctor that prescribed these drugs in this instance? I mean, if they have given a patient prescription, what's their responsibility in making sure that they detect that the patient is not at a point where they're silently addicted to the prescription? Do they then stop, prescribing that particular medication? What's their intervention in this instance?
So I think we've identified two areas which are problematic in perpetuating this problem. One is obviously the prescription by the doctor or the dispensing by the pharmacy. And remember, some of these codeine-containing drugs are available without prescription at pharmacies, and we're one of the few countries in the world that has that situation. So on the part of the medical professional or the pharmaceutical or the pharmacist, there has to be an increased awareness of what these drugs can do, potentially over long periods. But there is also a need for patient advocacy, and we're promoting a term which is how long. You'll be amazed at how many times patients are given medication and they don't ask their medical professional, doc, how long? So instead of the I am and the me too, we now need to introduce the hashtag how long, because often patients are not aware that they're not able to take drugs for more than, say, a week or two. And I see patients, because I run a pain clinic where patients are on treatment for with pain medication that have been on them for years. And when you ask them, why do you take it? It said, well, the doctor's been prescribing it to me every 6 months. So it's really, it's a double-edged sword where the medical profession needs to be re-educated in a sense in terms of the dangers of these drugs. And the patient population or the general public needs to be made aware of asking the simple question, how long?
Now, Doc, a patient themselves, in the case where they do, unfortunately suffer some kind of medical issues because of the constant and perhaps overuse of prescription drugs, what then becomes the consequence for the doctor who's been prescribing? Because again, you say, even though if there's no agency from the patient to ask the how long question, what consequences would a doctor then be facing for continuously giving drugs to somebody that perhaps stopped needing them years ago?
So that's a very good question, because most medical doctors have this innate sense of wanting to assist or help. And when you must remember, pain is the commonest symptom that presents to the medical profession by a long margin. So you often have patients coming in. The sort of gap in understanding pain lies in the fact that there is this perception that there's always a structural reason for pain. So you have to have an injury or some kind of an infection or some kind of a mechanical problem, when in fact a large proportion of patients with pain don't actually have any identifiable structural reason. Those are called functional pain syndromes. And patients present on a daily basis to doctors in pain. The natural instinct is to help. I don't think doctors are deliberately breaking the first law of medicine, which is do no harm. I just think in an attempt to help, and that coupled with the desperation of people who are living with pain for long periods, leads to the situation where they prescribe long-term opioid-containing painkillers, stronger. If one doesn't work, you go to a stronger one and a stronger one and a stronger one. And that cycle of pain and pain prescription comes out of, again, perhaps one step back, a misunderstanding or a lack of understanding of the concept of pain.
Doc, with that being said, what's the impact on one's quality of life when they are addicted to so-called harmless, drugs?
Oh, it's a phenomenally destructive pattern that people fall into. You must remember, we're talking specifically about certain groups which are very common here. Here, one of them is the opioids, which is painkillers, and the second one is a group of drugs called benzodiazepines, which are given for sleep and for anxiety and for stress. And with the COVID pandemic, with the looting, with everything that's happening in the world, and especially in South Africa, anxiety, stress are perceived as normal almost, So as a result, the prescription of these drugs become very common. And what happens there is that they're not actually treating the problem, they're treating the symptom. So I think, the situation at the moment is that we have, just to give you an example of numbers, alcohol, for example, is pegged at around 14%, whereas painkillers and these prescription drugs is a close second at about 11%. So the incidence or prevalence of this problem. So it's a huge problem, and we need to increase awareness on both sides about how the dangers of these drugs can affect people's functioning. If you take the opioids, for example, as I said, they're very closely linked to heroin. So they give you a sense of well-being. They make you drowsy. They help you sleep. So as a result, you end up using them for reasons more than just pain. And the understanding of what you're taking it for becomes very murky after a while.
Well, Doc, we'll leave it there with you. Thank you so much for helping us unpack this. That was Dr. Shakir Salduka, member of the South African Society of Psychiatrists.